right here. All right, can you see my screen?
Yes.
Great. Well, like Rhonda said, my name is Amy Rhone, and I'm the administrator of the Office of Special Education at the Nebraska Department of Education. And I have my Teresas here with me, Teresa Coonts and Teresa Hayes. And our hope today is to give you a little bit of context around all that's been happening at the Department of Education in order to support parents, families, schools, districts, and students with disabilities during the COVID-19 pandemic. And so the first thing that we thought we would do is we would take you down kind of a historical timeline from how we got to where we are today and then kind of where we are right now. And then from there, like you were told earlier, hope to answer some questions and get into some more specifics around what all is happening as far as guidance and technical assistance in all of these areas. So we're going to start with where this all began, maybe. So March 2020, our Commissioner of Education, Dr. Matt Bloomstead, recommended that school districts move to an alternate learning environment. And with this came the opportunity for schools to submit a continuity of learning plan. And we saw within some of the questioning that there's lots of questions around continuity of learning and what those plans consist of. So hopefully I'll be able to answer some of those questions here. But this plan was asked by districts to describe the temporary actions that support the continuation of learning and teaching for all students during the interruption of normal school attendance. And we titled this the continuity of learning. This was titled that way all across the nation. So of course, Nebraska decided to get on that bandwagon. One of the things that we feel is really, really unique in Nebraska is that we really only asked 2 questions, and that second question was pretty descriptive and not something that all states were really concerned about. So those questions were, how do you plan to serve your students? And then how do you plan to serve your students with disabilities? So within that, we created guidance around what is the continuity of learning and what does the continuity of learning in an alternate environment look like. It was important that we defined alternate learning environment and really created a space for schools to have an opportunity to be innovative and to ensure that all students across all backgrounds, race, ethnicities, and abilities have equitable access to continued learning outside of a traditional classroom. During this time, Nebraska's education mission remained the same, preparing all Nebraskans for earning, learning, and living. Each school district or school system was asked to develop a continuity of learning plan for an alternate learning environment. We have continuity of learning plans for our public school systems, our non-public schools, and our alternate learning environments. So Rule 18 or subset programs, level 3 programs that we're providing for some students were also asked to provide continuity of learning plans. So these school systems were asked to take some time. We gave around 5 to 10 days to develop a continuity of learning plan in which they should consider how they will serve all students and including students with disabilities and English learners. This allowed the school district or the school system to determine the best way to move forward, and it also allowed them to put a plan that would look different for each and every school system. As we know, across Nebraska, we have lots of different needs from internet to food security, all the way up to number of students in their buildings that they had to provide for. So there were lots of things that everyone had to take into consideration. Within this, we also asked that people really have a shift in mindset, and it also required a shift in skills in the delivery of whatever the opportunities for learning looked like for students. So school system leaders were asked to change the message from "we are canceling school" to "we are moving to a different method for teaching and learning." We gave tons of resources, and as you can see here, our first and foremost priority for all students was that of safety, health and safety during this time, which means that districts had to look at a lot of different things around their delivery. We had a heavy emphasis on school district systems considering a layered approach. This means that a school district system needed to think initially about providing some short-term enrichment opportunities, but it also then meant that they would need to move to a system and develop a plan that moves from providing only enrichment opportunities to providing educational opportunities. For example, third graders in a school might initially be given multiplication facts to practice using an online platform, and that particular enrichment opportunity was shared with the caregivers of all third graders. As school districts or school systems provide educational opportunities for students, including students with disabilities, the approach will look different for individual students. So this could include telephone calls, web conferencing, instructional packets, or video chatting with small groups of students to provide more in-depth support. When planning for educational opportunities, plans should consider the provision of special education and related services as directed per the individual education plan. So we knew right away that they weren't going to look the same. It wasn't going to be resource pullout. It wasn't going to look like we were used to, but we asked districts to really think and consider what these plans should include for their students with disabilities. And then we asked, how should we serve students with disabilities? We really emphasized this within our guidance. We've said educational opportunities provided to all students during a closure must include the provision of special education and related services as directed per their individual education plans. This requirement ensures students with and without disabilities are treated equitably. This requirement is also required by federal and state anti-discrimination laws, including Title II of the ADA, Section 504 of the Rehabilitation Act, and IDEA. So our mantra kind of became, our mantra became, and if anyone listened to our state special education calls or anything that I ever actually talked on, the mantra was, you can't do anything wrong except for not to do anything. And so we really, really encourage school districts to work within the constructs of their district leadership, within the construct of their teams, and develop plans that really fit the needs of their schools and their students. So school systems, their leaders should consider the use of accessible distance technology. We knew this was a real issue for a lot of our school districts. Many of our districts, especially in metro areas, were able to switch over easily. They had accessibilities, they were one-on-one initiatives, those types of things. There were many districts in Nebraska that the very first thing they had to think about is how to get computers to students or packets to students. So we didn't ever say there was one way of doing things. We really encouraged that they work with their systems to develop what was right for those schools. There are many schools in our state that just really were challenged with creating access to internet, especially in some of our rural communities, that it just looked different for everyone. So we knew right away we couldn't have this equitable approach to even the review of continuity of learning, that it would look different for everyone. So we also knew that there may be exceptional circumstances that could affect how a particular service is provided, which may result in the later need to provide compensatory or additional educational services to students. So IEP teams were asked to meet to determine those individual students' plans, and we right away sent out lots of guidance. So the Office of Special Education Programs, our federal office, came out with some guidance, and then the Nebraska Department of Education came out with a question and answer document that really helped to put some pieces together. So we took the Office of Special Education Programs guidance and Nebraskaized it, because there's lots of pieces in there that I don't know if everyone knows this, but Nebraska is a birth to 21 state. So not only were we looking at special education services for students, we were looking at early intervention services underneath that special education IDEA umbrella. So when OSEP came out with a supplemental fact sheet to go along with the original question and answer document, it communicated very clearly that ensuring compliance with the Individuals with Disabilities Education Act, Section 504 of the Rehabilitation Act, and Title II of the Americans with Disability Act should not prevent any school from offering educational program through distance instruction. Again, this really emphasized you can't do anything wrong unless you're not doing anything. So we really worked hard to make sure that districts understood that it was OSEP and the Office of Special Education at Nebraska Department of Education's expectation that they serve students, knowing full well that it wouldn't look the same. Then in April 2020, 4 main focuses came to light through another federal or national organization called CASE, which in Nebraska is supported by, it's called NASIS, the Nebraska Association of Special Education Supervisors. And so we really focused on these 4 areas, which were focusing on the safety, health, and welfare of students and staff members in your community. Provide FAPE, so deliver services to as many students as you reasonably can in the best way that you know how. Document your efforts. Make sure documentation is focused, consistent, detailed, and demonstrates a good faith effort to provide good services. And compliance during the pandemic. Ultimately, IDEA was not built for this. We knew that, we recognized that, so we knew that we had to start thinking outside of the box for providing for our most vulnerable population. We also really emphasized communicate, communicate, communicate. So highly effective school districts will collaborate in good faith with parents and families to be proactive in an approach towards addressing the impact of COVID-19. Because we knew that this wasn't just going to impact students with disabilities, this was going to impact all students. And so we really needed to be able to arm districts with what that looked like. We also pulled out our handy dandy ESY guidance document from 2018 that was revised. We also did some specific technical assistance around those extended school year considerations and what ESY was designed for, which is not to resolve issues created by a pandemic. So we had to do some technical assistance and provide some guidance around this. And we'll get into more of that as I move into the Launch Nebraska guidance. So Launch Nebraska was released a couple of weeks ago, but specifically guidance in special education under Launch Nebraska came out last week, Friday. So literally last week. This platform is full of tools, actions, opportunities, and resources to support the complex planning and preparation needed by Nebraska school systems as they work to restart schools and support students as they transition back to school buildings. Fingers crossed, right? So there are 2 of the 3 guidance documents already available on the site. The first of which is the guidance for summer school and summer learning. As we know, educators are working under extraordinary circumstances as the 2019 and 20 school year ends. The transition to remote learning has shown a spotlight on a long-standing inequity across communities. Given the impact of extended building closures on student learning, summer school is a strong strategy to ensure that all children continue their academic and social emotional learning and receive the health services they need until they re-enter school buildings. So the purpose of this document is to provide guidance that school districts and school systems can use as they plan summer learning opportunities. This document offers resources and considerations based on what has been learned in the shift to remote learning and the research behind summer learning. So it is well documented that students often begin the academic year at achievement levels lower than when they left school the prior year. So this gap is known as the summer slide, and this document really helps to give some research-based practices around what you could do to eliminate summer slide. Now, that's eliminating summer slide without your typical pandemic measures in there too. So we also had to take some of those pieces into consideration. So current projections show that there will be even greater gaps in the student achievement due to extended COVID-19 related school closures. I mean, that's a no-brainer for us. And so we also needed to look at what this meant specifically for our students with disabilities. So the second document that you see here is the Learning Guidance for Students with Disabilities for Summer Programming and Beyond. So this document helps districts and families to understand the importance of planning for our students with disabilities when providing summer programming and reopening school buildings. As we know, this requires an unprecedented level of planning. Also, much preparation, resources, and coordination. We are actually like in awe of what our teachers and school leaders have been able to do in March when they were given like 5 days notice. So we're really excited about what schools will come up with thinking outside of the box now and given a little bit of time. And I say a little bit because I don't mean very much when we've thought about education as a platform for years in school buildings, and now over a period of 2 months, really, we're shifting everything the way we think completely. So this document helps districts and families to understand the importance of planning for our students with disabilities when providing summer programming, and it requires us to really work within all constructs. We've been touting for many years now that special education students are general education students first, and so we really were intentional about our release in this guidance. It came out as a two-parter. Because we really want school systems to start thinking about this holistically. So yes, it is very important that we think about those special education services and what needs to be provided per the IEP, but we don't want to lose sight that these kiddos are students too, and they're going to be coming into the school buildings with some trauma. They've been not in school buildings, not used to these systems. They lost the ability to say goodbye to their teachers, and some of these students really suffered from anxieties and things that potentially would have increased those possibilities for gaps already, and now adding this on top of it just makes them more vulnerable to those pieces. So the third document that is coming, and when I say coming I mean within days, is a health guidance for summer learning and beyond, and it's a joint document with our Department of Health and Human Service partners, and as a package is a really good technical assistance or pathway guide to what school districts need to do holistically for school openings. So the learning guidance for students with disabilities has these main focus areas. We looked at unfinished learning due to COVID-19 specific to students with disabilities, questions to ask to determine unfinished learning, extended school year, compensatory education services, and then we did a question and answer specifically around IDEA Part B, or our school age kiddos, and then IDEA Part C, or birth to age 3 infants and toddlers. And then last but not least, we also addressed the non-public students who are receiving either FAPE or equitable services. So within unfinished learning, we really focused on what the state and federal guidance and the implementation of those regulations hold for districts. So the local educational agencies or districts are required to provide both equitable access to general education opportunities and to continue to provide a free and appropriate public education to students with disabilities to the maximum extent possible. Many of these students will receive FAPE during the period of closure. However, it is acknowledged that despite best intentions, efforts, and creative solutions, there are some students who will not receive a FAPE over the course of the school closures. So therefore, LEAs will need to make an individual determination for each student around the unfinished learning. So we developed what we are calling our flow chart around decision making, so that it really helps districts to look at specific scenarios and what they need to do. Within this document, we then move into extended school year, really focusing on the key consideration of understanding unfinished learning through that of the extended school year, or ESY provision. So the purpose of an extended school year is to prevent or slow severe skill regression caused by an interruption of special education services during extended periods when school is not in session. It is not to enhance the present levels of educational performance exhibited by children with disabilities at the end of a regular school year. So this was really important that we help districts understand this. We had many questions come up, as this is supposed to be the last week for many school districts, last week and this week, around, hey, shouldn't we just probably provide extended school year in this remote environment? Well, the issues that surround that is extended school year may not look the same as what a regular school year services may look like, and that's all determined in an individual education plan by that team making those decisions. So we didn't want to blanket statement say, hey, yeah, just start providing extended school year to all kids. There should be opportunities for special education or students with disabilities to be offered summer school or extended learning opportunities, but also extended school year is supposed to be something that all students on IEPs have the affordability of participating in, should the team determine that they need that. So then we also define compensatory education, and this is extremely unprecedented or uncharted waters for many, and so it was important that we not only define compensatory education, but then we go further into the document to answer questions or do a question and answer scenario type situation, so that many could fit their current situations into some of the questions and receive answers. So compensatory education services are not expressly defined in the IDEA. However, courts have long awarded compensatory education, or in Nebraska's case, investigations have awarded compensatory education services as an appropriate remedy under the IDEA when a student has been denied a FAPE. In the present circumstances, the purpose of compensatory educational services is to remedy the district's inability to provide a child with a disability with appropriate services during the time that the child is or was entitled to a free appropriate public education. So the big question that we've been asked over and over again is, what is the difference between ESY and compensatory education? So all children with disabilities who have a current IEP must be considered for extended school year services at least annually. Extended school year, again, remember, is to look at recouping during a time that there may be loss. So a student has the ability, or maybe has a higher opportunity or chance to lose information over a period of time. Whereas compensatory education services is to remedy the district's inability to provide a child with a disability with appropriate services during the time that the child is or was entitled to a free appropriate public education. So they are very, very different, although they may be considered as one thing that they could be provided for compensatory. Teresa.
Can you hear me?
You clicked out, yeah, start over.
So the other thing on ESY, kind of the difference that I always try to explain to people is extended school year is in the law. So it is a part of the decision making through the IEP and everything. Where, like Amy said, compensatory education is not, it's determined by the courts, and that kind of helps people. ESY is not going to go away because you're going to have to do that. You should be doing that every year. We've had a TA document for years, so that's a good way to kind of look at it as well. for compensatory ed, we haven't been down this path many times before in Nebraska. So it's a little bit new for us as well. But just wanted to put that in and get my mute button working as well.
So we decided that we would leave the legal jargon in the guidance document because we didn't want to necessarily overwhelm people with all of the technical assistance that we are continuously working to provide. We know that there's more, obviously, that we need to work around provisions of early intervention and special education services. We also realize that there's a need for clarity in a very unclear time and hope to be able to continue to provide guidance and technical assistance as needed to schools, districts, families, parents, and students. We look forward to your questions now, as we feel like this is the best time for us to learn where there still may be additional need for guidance and communication. So we thought we'd just leave it now open to questions. And do you want me to stop sharing, or how do you want me to do that?
Actually, Amy, would you want to go ahead and show the last slide, which has your contact information, so that way everyone should, if you registered prior to 4 o'clock, I sent out the slides for the presentations earlier this afternoon. But in any case, here's some contact information. So you should have that in the slides as well. And then, Amy, I thought I could just go ahead and kind of show the categories that we had sort of delved into, and then we go ahead that way, if that would work for you.
Sure.
Okay, awesome. Okay. So some of the questions that we had received from families, and I think some of this you may have covered already and kind of gone into some of it, but I think maybe it's worth repeating and having kind of a chance to kind of dig even deeper into some of those. But have students' rights under IDEA been waived during COVID?
So actually, there has been no waiver of anything under IDEA during this COVID pandemic. Absolutely no waiver to student rights, no waiver to parent rights, no waiver to anything, including anything fiscal, which we're working on.
Should we still have my child's IEP MDT meeting virtually during this time?
Absolutely. So if it's a possibility, our guidance has been to all districts that they continue moving forward in a virtual setting with IEP meetings. So MDT meetings may actually be a little more difficult. So it really just depends. Many MDTs, depending on the evaluation measure that they're using, require face-to-face with students. So it's possible that they may not be able to continue that MDT. We know this, districts know this, that this may be a timeline that they don't meet. So in Nebraska, we do have a 45-day timeline for evaluations to be complete. And we know at this point in time that that's something that they may not meet. But they're supposed to be trying to conduct as much as possible. And if they can, many SLPs or other services can be adapted to a virtual environment. So if that's something that the district has access to and can do, they are more than welcome to try and continue those processes.
What would families expect from early intervention during this time? Are home visits still allowed, since that's typically the format for those?
So actually, the answer to this can be found to our question and answer. The Nebraska Department of Education's question and answers divides into two parts, Part B and Part C. So anything specific around Part C or early intervention, you can more than likely find in that document as well. So the long and short of it, though, is that if school buildings were closed and those were the provision of services, home visits would not have continued. In most situations, services coordination continued in a virtual format. And in some situations, there were some services that continued on the early intervention side because of the tele model that was in place. But again, it would completely depend on the provider and if they had that ability. Teresa. Oh, sorry, Teresa Coonts. I think you're.
Can you do? There you go. Okay.
Yeah, she mutes me, so I can't speak up. I'm sitting on my hands here. I think this is a really important one because I've talked to a lot of school districts and people that are being really creative at how they're at least touching base with parents. So even the providers that are on those IFSPs are touching base with parents. Now, you know, we switched years ago to a coaching model. So coaching models can be performed virtually. And so in some cases, this is really happening across the state, and it's exciting to see the creative things that they've come up with. I think it's, I work in the low incidence in autism. I'm always amazed when I see the things that they're doing to provide that type of support across the state. I'm not saying it's perfect, but at least they're trying to figure it out and work through.
Should individualized education programs be changed to reflect distance learning? In that, should there be maybe a specific IEP just for this time of distance learning?
So districts always have that option. Some definitely did do amendments to IEPs, do prior written notice around what the provisions potentially look like. Some wrote new IEPs. It really just depends, and it kind of depended on what the district was able to provide. So every single district would look different around this question, but the short answer to it is that every district potentially could have an option that fit within a change in the IEP.
Then you did touch on this just a smidge, but what about educational speech, OT, PT services or other related services that my child has missed during this time?
So again, this would completely depend on what the district was able to offer. Some moved to a tele model where they were providing teletherapies. Others were able to utilize virtual platforms working with the providers. So it really just depends. If those were things that weren't provided or weren't able to get to, then an individual education plan meeting, a team meeting would be pulled back together to determine what those services would need to look like.
So what is the criteria for qualifying for compensatory education?
So there's not really a criteria. As we go into more legal detail in our guidance document, compensatory education is not defined within IDEA. It's meant to be an equitable remedy. So the idea around compensatory is that IEP teams so districts work with parents and those members of the IEP team to determine what services were missed should they determine that FAPE wasn't provided to that student. So we go into a lot of detail in the guidance document around unfinished learning, extended school year to recoup some of that information, and then as a kind of last, not ditch effort, but last consideration is this idea around compensatory. Because if a district provided for a student, there was a provision of FAPE, does it look perfect? Does it look like everything that was needed to be provided to that student? Possibly or possibly not. And that's what the teams need to come together and determine if that lack of service led to a lack of progress for individual students.
I'm getting a couple here on the chat, if I can just cut in here. We were given prior written notice at the time of school closure. Does that mean that we need to have an IEP at the beginning of the coming school year?
So it will depend on whatever the district determines is their mechanism for communicating when school comes back to normal. And if you can't see me, I'm air quoting normal because I don't know that anyone knows what normal looks like right now. But when schools come back and there's a different delivery from that initial prior written notice, then potentially there will need to be another form of communication, either an IEP meeting, another prior written notice, some sort of communication to describe what services will now look like.
We've got one more around the IEP. If there was an amendment to the IEP, are these time limited?
So that's a really good question. If it would 100% depend on if they wrote a time limit into the amendment, or if they, like many that we've seen say during the COVID-19 pandemic, which doesn't really put a time limit onto things. Some say during remote learning opportunities, which boxes in kind of a time frame, but it doesn't say specifically March to July. If an amendment says March to June, March to July, something like that, then the time frame would need to be followed. But ultimately, if it just gives a time constraint around pandemic time or that, then it wouldn't necessarily be around a actual time limit. And I don't know, we've seen many different versions of IEP amendments, so I don't know what they specifically say.
Do you have any more, Jennifer?
Maybe just this one. You mentioned earlier that IDEA provisions haven't been waived, but then stated that services provided would depend on what each district is able to provide. So during the COVID school closures, is FAPE for a given child based on what that individual needs or on what his or her district is able to provide?
So that would be, FAPE would be whatever the provision for the student to make progress based on either what they provided in prior written notice as to the services that they would provide or an IEP amendment, but whatever FAPE is defined in that child's IEP.
Going forward, will the Department of Ed provide guidance to schools regarding compensatory ed? When will that come out and will it be made public?
Yes, it came out last Friday. It can be found on the launchne.com webpage. It's deceiving because it's not titled compensatory education. It's titled summer learning and beyond, but it can also be found specifically on the Nebraska Department of Education special education website. So if you don't want to comb through the Launch Nebraska site, on the front page of our SPED webpage, which is education.ne.gov /SPED, you can also find all of our guidance documents, and it's listed on there as well.
We had one here, I'm glad you've already covered this, regarding ESY and compensatory education and kind of what the differences are between that, so thank you for that. Will districts be offering summer school, or should they be offering summer school to students with disabilities?
So this is an individual district determination. Again, not to be confused with extended school year. So if a district determines that they're going to offer remote summer learning, and that's being offered to all students, including students with disabilities, that's absolutely something they could do. But if they have determined that a student on an IEP, because it's an individual determination, needs extended school year, then it would still be the district's responsibility, even in a remote environment, to provide that extended school year.
So just to kind of clarify then, so if you've had your IEP meeting, and maybe that was prior to March when this all, maybe that it fell in the fall, and that was part of what your team had determined that your child was eligible then for those ESY services, they should then be expecting that then for their child then this summer. Is that correct? Okay.
Yeah, so I think what happens a lot is that they'll decide within the IEP meeting, the annual meeting, that extended school year will need to be offered, but it might say in the IEP that they'll reconvene to determine what that extended school year looks like. So if your IEP does say that, then I would definitely be reaching out to your school districts. If the school district hasn't already reached out to you to say, hey, can we have a meeting to determine what this is going to look like, especially in a remote learning environment, because it may need to look different than what the initial plan was.
Jennifer, any other questions coming in to you?
Yes, so we have a couple of questions about asking about compensatory time for summer school. Can we ask for that? And another question is this something that should be considered? Is the only way to go about that is going through the court to ask for that?
So I'm going to try and restate the first one. Can they ask for compensatory education to be provided during summer school? Is that
yes?
The question? So right now, school districts are still finishing out the 1920 school year. So this summer, the June and July months will be the months that will finish out the 2019-20 school year. So compensatory education will need to be determined at the end of the 2019-2020 school year if it is something, if a student was not provided FAPE. So if it is determined that that student is in need of compensatory education, then that would be determined and provided. It could look like summer school outside of extended school year, because it wouldn't be extended school year if the student was already afforded extended school year. So it could look like summer learning activities. It could look like after school activities. It could look like additional activities within a school day that don't interfere with the already afforded provision of FAPE in a student's IEP. So it can look a lot of different ways, but summer school is definitely an option for that, to be able to provide the service that was not provided during that time as determined by the IEP team.
Okay.
And then there was part two. Did I get that? I think I got it, right?
If the parent feels that the compensatory ed is something that should be considered, is the only way to do that to go through the court? Like if there's a disagreement between the school and the family about that compensatory time?
So there's actually many options in finding resolution around dispute within for parents and districts. One of those options could be mediation. One of those options could be a formal state complaint around special education, or the last option could be to file a due process. But there's many options that could happen prior to going to the courts to ask for the court to weigh in on that.
This parent asks, can you give any examples, or are there any kind of red flags that families should look for as far as if a student has not received FAPE during the last few months of school?
So I would say the biggest red flag is if you have not had any communication at all from anyone from your school district, then that would be the red flag to look for. In Nebraska, we only had one district that didn't provide a continuity of learning plan during the time frame when we were asking for it. Since that time, they have provided that. So in what we would tell you is that all districts feel like they are providing services or some form of services and trying to do the best that they can for students during this time. So if you haven't heard from anyone, if you haven't received any kind of communication, if there's never been any email contact, nothing, then I would say that would be your red flag around provision of FAPE.
Okay, and then the last one kind of regarding the ESY or compensatory education. My child is getting speech services for articulation and social skills. During our last meeting with the SLP, we were working on social skills, and the SLP said it is difficult to do over Zoom as far as the social skills go. How can I ensure my child will get social skills help if remote learning continues through the summer?
Yeah, and that is really hard. We have developed some guidance around significant cognitive disabilities around how to provide social emotional skills. We also are working through the Launch Nebraska. We've put out a 12 web or virtual series around introduction to general education with the Nebraska MTSS team going to come in August to develop or to provide a 6-week SEL series. So really looking at those social emotional constructs for instruction, knowing full well that none of us were prepared to be virtual instructors or providers, right? So during this time, it is really about enhancing all individuals' knowledge and skills around how to provide for students in the very best way remotely, and then also how to help once we transition back to traditional or normal setting with students coming into the building after being out of the building for so long. So we know that this is something that we're going to continue to provide guidance and supports around.
Okay. I know we've had some questions about like progress monitoring and those types of things, and being as currently and possibly going into the future, parents are really kind of the primary teacher for students, if that's the case with distance learning. So are parents responsible for collecting data and doing that progress monitoring during the time of distance learning, or how is progress monitoring working?
So it's going to look a lot of different ways. I think the key here is that parent input is going to be key because they are going to be the ones that are most in contact with students. But parent input isn't something that we aren't supposed to be collecting outside of a remote environment. So hopefully we are really, really good at collecting parent input anyway. We know that maybe that's not always the case because those who provide services really rely on that service provision to measure progress. But definitely parent input is always a responsibility of the IEP team to collect. We also know that this partnership is pretty key. Teresa talked earlier about the coaching provision or teaching how to do these things. So it is not the responsibility of the parent to progress monitor. It is the responsibility of the parent to be an active member of the IEP team and to provide input on anything and everything that they can. So it's the responsibility of the providers to ask the right questions, right? So hopefully, and we've worked really hard within our different programs to provide guidance around what those questions should look like, what should we be looking for in this remote environment. It's very hard to measure engagement. So what are some questions you could ask around or of parents to really measure what engagement might look like? So we've been working hard to develop that guidance as well.
Is there a piece that, like for instance, I know not to be too specific, but say your child has a behavioral goal and there's something where you're actually, like part of that is monitoring how many times a certain behavior or whatever happens. Is there a way to train parents to do that so that we can still be kind of keeping track as to how they're doing?
Absolutely. We see this, and Teresa, I might have you speak, TC, I might have you speak. Our ASD network has done tons of training around behavior tracking tools, time on tasks, and different things like that around the state. So I'll let you speak to that, Teresa.
Yeah, I was just thinking that's definitely something that we have consulted on virtually, and we've worked with teams on that piece as well as with parents. And I would say not just in the area of autism, but around a lot of areas, you know, of just helping them understand that piece and how to take just minimal data, you know, which can still give you good input. And I think that's been a very successful thing. I think we can still improve and learn more, but we've had some great parents teaching as well and learning how to take data. So I think that's a critical thing. I kind of wanted to lap back also to the social emotional discussion, because in the areas that I work in with autism, deafness, blindness, and deafblind, traumatic brain injury, all those areas, we have to deal a lot of times with social emotional issues. And I just want to say that all of the areas that I'm working with have just stepped up to provide additional supports. But we're having virtual social get-togethers via Zoom with kids, making sure everybody's having access for that. We're connecting families together at some points too for those connections as well. But the social emotional piece was something I was so worried about with this group of kids. And I'm not saying it's going to be perfect, but I think any time that you can still connect even virtually to provide something that's similar to what you've done face-to-face is very critical. And I would say with all of these groups, we've seen them really step up to offer virtual camps, virtual social groups, virtual cooking. We're being safe with our cooking. We're not using stoves, but we're teaching with microwaves. And so I think all of that helps with social emotional pieces as well, because you're still promoting what work you've done in the past, but just in a different environment.
Having to do a lot of thinking outside the box and kind of redoing things in a different way. And yeah, so I think, Amy, you kind of touched on this a little bit. One of the things that I think has really been highlighted through this whole experience is that there is a lot of inequities across, you know, as far as like what access different families have to certain things, whether it be in rural communities, but specifically if families don't have computers or internet access, what is the obligation of school districts in regards to distance learning?
So really early on, we made sure that we communicated that there has to be a multitude of platforms. So if a parent doesn't have access to even a device or internet or any of those pieces, that paper packets and telephonic support be provided to that parent and to that student in a multitude of ways. I know that, you know, we in our deaf and hard of hearing programs, they've had drive-by classes that happen. So there's lots of different avenues in which districts do have that responsibility. I will tell you the Department of Education is looking at some pretty federal grants and the use of CARES Act funds to hopefully ensure this equity provision to our students. But even if we got every single student in Nebraska a Chromebook, there are some still that just don't have the access to the internet. We don't have the broadband across Nebraska to support this. So these are definitely things that we're looking at from a state lens, not necessarily individual district lens. But a district does have responsibility to provide for that student in a means that meets that student's needs. Teresa, TC.
Oh, I'm so sorry. Let me get you unmuted there.
I know, I keep clicking. I think the other thing, because I've heard some really great stories of creativity here as well, of hotspots being bought, And then we all know that a lot of our companies stepped up to give free Wi-Fi for a period of time too. So that really helped out in some of our areas, especially in some of our rural areas where that's a big challenge. But that's another area where, I mean, I know teachers of the deaf and teachers of the blind that have delivered things and showed up to set outside so kids can have access. So there's a lot of great stories of support, and I don't think we, you know, I'm from the South where we brag about everything, but I've been here since 1999, and this state does not brag about themselves, but I really feel like we do a great job. I went in and read some of these contingency plans, and they're public, so you should go and look at some of the things that's in there. It's amazing to me what they've done. And I look back and I think it happened in mid-March, and this is just, you know, mid-May, and we're, you know, I'm kind of amazed. And I'm not saying, like I said, it's not perfect, but I think when we told them districts to step up and when we had to step up, I think everybody did. And I think that's, I still go back to something the commissioner said, and I get a little emotional, but I'm going to go there. He said early on, we have to have grace in this situation. And I think that's a really important word, because none of us have done this before. And that's true throughout the nation. And I hear stories from other states where it's not working as well. And so, so just some of the things that I've seen is just, it's been amazing. And I keep saying we need to continue to record these things, because I think we can learn and improve on the things that we've even developed to make sure that everybody has access. It's something that we still need to continue to work on, but people are discovering ways to make it happen. What they worry about, our teachers of the deaf and all of those areas, is when that Wi-Fi shuts down. And so we can't provide things because they have provided it for 3 months or 4 months. So what do we do when that shuts down? That's kind of a challenge that's coming up next, I think. So
kind of looking for some of those more long-term fixes where some of this has been kind of a Band-Aid to get us through the initial, yeah, gotcha. Okay. How are families with limited literacy, or maybe if there's like a language barrier, being assisted through the COVID crisis?
Yeah, so ultimately it's been a ton of support. Either the district has been providing interpreters. There's been a lot of support from PTI around this. So I think initially people just went into panic and provide mode. And then once they kind of stepped back and found, oh, here are some of the barriers that if we maybe got rid of these, we would have more provision or more access, then I think they started putting plans into place to start working through those. Again, not to perfection, but definitely providing things in multiple languages, providing translation, interpretation, all of the pieces that need to happen so that it is accessible to all. Our students with disabilities, and then our students with disabilities with language barriers as well.
Another kind of subset or group within the special education family, I guess, transition students. How are their needs being met? So kind of specifically those 18 to 21-year-olds that are still receiving education services. Well, what does that look like?
Hayes, do you want to answer this? Can you unmute Teresa?
Just
I would say,
go ahead, I'm sorry.
No, you're fine. I would say that kind of like what Amy has already spoken to before, it really varies across districts and what is available, and knowing that that's not going to probably look the same everywhere. We do know that Voc Rehab is virtually working with students on their pre-employment transition services, and the work-based learning part, since a lot of the businesses are closed, obviously those opportunities aren't available right now. we do have a few summer transition programs and agencies that are doing some programs virtually. And again, just like Teresa and Amy have talked about, they're doing some really creative things to offer some things for kids to work on some of those skills in some summer program opportunities, all virtually. And the stuff that I've seen has been very impressive and creative in how they're trying to go about offering some of those things to students. So again, kind of varies, but there is a lot of creativity there also in when those opportunities are being offered and given to students. So, yeah.
Thank you. Jennifer, do you have any questions from the chat?
Yes, we had kind of a two-parter come in on recording on taking data. The first one, is there any guidance from the state given to the districts on recording data on Zoom during Zoom lessons in regards to the IEP goals?
So we actually utilized a CASE, that national organization. They put out a really good webinar on progress monitoring that we also linked to our website, just around how to, again, a lot of it is dependent on engagement, especially if it is in group settings. So if they were delivering to general education and those goals needed to be looked at for that specialized instruction that was happening with that student, just some things to key in on. So we shared that national presentation that happened. And then we just also continued to reiterate the progress monitoring component within our statewide directors call, so that it's always on the forefront for our directors to be thinking about.
Okay.
And I know, can I just, Holly Schweitz is on with us here. She is from PTI Nebraska and just mentioned in the chat to me that PTI does have a simple log to assist parents with IEP goals and services provided. So if you go to their website, again, I had a link to that in my presentation PowerPoint slides, so everyone should have that. But there is, if you go to their website, they have kind of a template set up so you don't have to kind of reinvent the wheel.
If there's being guidance, is there also guidance being given on weighting the validity of the data at the next IEP?
So that is the million-dollar question. So there is, realistically, there's no way except for to administer a vetted assessment or evaluation around true validity. So we just encourage that districts utilize that as input, anecdotal data. They're always encouraged and collecting all of the time. So it would just be in the same way that they did previously in that collection.
Okay, then we had, you had mentioned and kind of went into some detail about continuity of learning. Will those plans continue into the fall, or will there be kind of a new plan put into place? What does that look like?
So we are encouraging districts to continuously update their continuous learning plan. We have had many districts submit updates. Even now, a week into their plan, we had districts submitting updates into their plan. Those are currently public on the Nebraska Department of Education website. And as updates come in, we update that. We also have encouraged districts to make this public within their own web or communications that they put out to parents and families, just because it is such a living, breathing document for many. The continuity of learning plans really are what districts were doing under accreditation. And so when we do move back to a traditional environment, so moving into the fall, August of 2020, there still may be continuity of learning plans depending on where we're at in our setting, but we also will then continue to move and shift those to those continuous improvement plans that districts are always doing for their schools to continuously improve on what they are providing for students.
And then that kind of leads to the follow-up then with are families then informed by the district of the continuity of learning plan, or is that something that they should seek out if they're interested in that at the Department of Ed's websites?
So they can find it on our website, or they can always reach out to their district. I don't know that districts aren't sharing their plan. They shared it with NDE, so I think they could absolutely reach out to the district. I know many districts have already published those on their website or in like a newsletter or whatever they do within their own districts to publish information.
Okay, so now we're heading into fall planning. So if you have your crystal ball, and we know what it's going to look like in August, but just some things I think that are on families' minds. Yeah. Is there a date that districts need to finalize plans for the fall, you know, kind of on that continuum of where we might be? And are they going to announce so that families have an opportunity to maybe participate in that planning? Because I think sometimes families are able to kind of come up with some other things that may be some of those barriers and can help kind of figure that out ahead of time.
Yeah, so I really do wish, and I think every district wishes that I could give the answer to this. It would make their planning a lot easier, but honestly, our guidance is week by week. We work with UNMC and all the local health departments in making these decisions for each individual region. So it's not even a statewide decision. As we roll out into this, it may look different in Lexington, Nebraska than it looks in Scottsbluff versus even Papillion La Vista. So it could look different everywhere. Unfortunately, we have no idea, the length of time that will be under the direct health measures that we are currently, if those will change next week, and if they change next week, what that could reflect for learning. We have no idea what it may look like a month from now with the proposed resurgence and potential for additional direct health measures put in place once we even have opened up again. So we are literally every single week reviewing and changing and deciding and listening. We even at the department listen intently to the governor and say, okay, now what? So yeah, there is literally not an answer for that question, unfortunately.
I think we have frequently made the comment that it's like trying to make plans while standing in quicksand, because it's constantly shifting and changing and you just have to adapt. So, but I do think this kind of leads into the next one. Is there a timeline as to as school approaches for districts to make a decision as to what exactly it is going to look like? In that, families need time to plan. If you're talking about doing A/B days or half days, how are families going to have a time to work with their employer or childcare provider to make that work?
Right. No, so there isn't a timeline. Okay. The commissioner has recommended that districts start developing a rollout or a roll into a phased in plan. But again, we're still working under the parameters of finishing up 2019-20. So we need to get through the summer of this year and finalize all of that, knowing full well that we need to do that parallel with planning for what the fall looks like. Teresa, Coonts, did you?
Well, and I was just going to say also part of that Launch Nebraska, because I'm serving on the facilities committee, which is, so Amy's so right, is we're trying to close 1 year, but we're also trying to think ahead and just provide as much guidance as we can. So this committee is through our safety department at the office or at the Department of Ed. And we have school personnel on there, from principals to teachers to special ed directors, a wide range of people. And just trying, and we're looking at everything within the facility, the classroom, the hallways, the restrooms, and trying to just come up with some guidance thing. And I'm on that committee to just think through all the populations of special ed and how we can, you know, think of the questions that may come up. And there's, as we meet, we've had only 2 meetings and we develop more and more questions. So, but I do think that we're always working, you know, on finishing up this year, but then we are planning ahead because and I think there's a lot of committees doing that work because I know Amy's been involved in some of that work as well. And that's just something we have to just be ready for. And then we may have to tweak at the last minute like we've done before. So it's hard. I know everybody wants the answer. I have to tell all my, I mean, I do the same thing with all the groups I work with, and there's just not a good answer for that. It's week by week, sometimes day by day.
And I think if you would ask the district personnel, if they were on this, they would tell you they have a plan A, plan B, plan C, and then plan D, which is contingent upon if we're doing A, B, C, or D. So I know that I met with a school district today that has a phenomenal rollout dependent upon the rollout of the direct health measure and where the city lies. So they are literally at the whim of whatever today's direct health measure says. And I can't, it's amazing. Amazing.
And as far as, again, Paul, is there an acknowledgement or consideration for children with disabilities and their siblings who are immunocompromised or at higher risk categories, like myself, my daughter, it would fall into that, and how that might, or maybe they can't social distance, that would be something that would be very challenging for them to understand or follow.
Yeah, so this is actually the next on the list around guidance documents that we're trying to develop. And this is, again, a holistic approach. So yes, students with disabilities probably are the largest vulnerable population that make up this subset of population, but it's not, I mean, there are lots of students who are immune compromised who aren't on IEPs as well. And, you know, one of the things that we really want to be mindful about is the parent's decision to really do what they think is best for a child, their child, and not have that be a penalization around compulsory attendance laws, around attendance barriers. So there are lots of things to think about, and we will definitely be issuing guidance around what that should look like. And to be provided an option and be able to say no to that option without the penalty that might ensue. So again, districts may have to run parallel programs, right? A remote environment and a non-remote environment dependent upon a parent as well. So knowing that, we want to make sure that we are able to give really good guidance around what that could potentially look like.
Jennifer, were there any other questions that you've gotten in the chat regarding fall and what that might look like? Oh, Amy.
I just want to add one more thing, because the worst thing that we want the worst situation we want parents to be in is to think that the only option for them is to homeschool that child. So public education, non-public education, education in a environment should be afforded to that child. And we want to partner with parents to make those decisions that are best for them and their students. So we definitely have so many things to think about. Sorry.
No, that was helpful. Thank you.
Yes. If a child was in the process of being evaluated for special education when school closed, so they could not finish the evaluation, once school starts again, and if the child is in special education following a full evaluation, can the parents then ask for compensatory education to make up for that special education time lost due to the delayed evaluation?
So this would be interesting. And so I don't have a yes or no answer to that, because I wouldn't be the one awarding this. But I think there would be a multitude of avenues in which the parent could take to help determine where they wanted to go. So just as student rights weren't waived, parent rights weren't waived in any of this process either. So a parent still does have their parental rights and procedural safeguards. So if they would come back and not be satisfied with whatever decision is made either by the IEP team or potentially by the district, then they could exercise their right to file a complaint, ask for mediation, the entire dispute resolution umbrella. So, and with that ending in due process, if that is a direction that they would want to go. And child find is something that would be, could be investigated either through a complaint or a due process within that. Absolutely.
Thank you.
Sorry, I was on mute and I didn't realize it. Okay, so we had a couple of questions regarding communication, and I was really happy to see, you know, you had that in your slides, Amy, like communication. I just don't think that can be stressed enough, because I think that that can sometimes be where we get stuck if the communication just hasn't been there. So we have not received any communication or supports from our school. What do we do?
So again, you have a parent has lots of options. Well, not lots, ultimately 3, but I would start with trying to reach out yourself to the district, see if you can get anywhere with contacting the principal, contacting the special education director, or even the email address for your IEP case manager if you need to. I would start there. And then if you don't hear back or you don't get any communication from there, you could reach out to the district office and see if the district office could remedy communication barriers for you. If that doesn't work, you could utilize an advocacy group such as PTI, disability rights, anything like that. If that doesn't work, so this isn't like a hierarchy. You don't have to do one before you go to the next. So really it's like a flow of all of these options. You could always reach out to us here at the Department of Education. Any person on my staff is more than capable of communicating with districts, maybe finding out what the barrier is for them. And then if that doesn't work, there is always the dispute resolution process within the Department of Education to try and help remedy those as well. But we will tell you that we have what we call step in. We have stepped in on a couple of occasions now where just communication has been lost. It's a natural loss when you move away from your school phone or potentially even your school email, and things are routed differently, and we've been able to help connect. So we are always willing to do that. I know PTI has stepped in and had to do that often as well, but worst case scenario, reach out to us. One of the Teresas or I will gladly help connect in any way we can, and then also walk you through your procedural safeguards should you need that.
And I think that kind of leads into, you know, our next section, if there aren't any other questions regarding communication, which is concerns or grievances. And I think, again, like you said, you kind of touched on that a little bit, but if, you know, that there's a number of different avenues and ways to kind of try to build that communication. What's the process once a concern has been, or a grievance has been submitted to the Department of Ed?
So there's actually 2, because concern and complaint, concern or grievance and complaint are very, very different. So if you contact us with a concern, we hope that we can help remedy that through just some open communication, connecting people. The process is we'll start looking into what maybe the problem is. We'll communicate back with parents and try and remedy that. Should a complaint be filed, and this would be a formal state complaint, then that takes on a life of its own because there are very legal timelines and procedures that have to be met. Within 14 days of the issuance of the complaint, the communication has to go back to whoever filed the complaint and the district involved in the complaint to express what issues are going to be either investigated or that were found to not be investigated. And then within that, there's a 60-day time frame in which the investigation has to happen. So there's always the ability to extend those timelines based on extenuating circumstances, but for the most part, that's the timeline that exists. And all of those extensions are all communicated through the parties that are involved in that complaint process. Teresa, Coonts. I think you're unmuted.
Yeah, I just wanted to add, sometimes I think, because we talk a lot to parents, and but I think some parents are a little afraid of calling us. And I would say a high percentage of our calls are dealing with concerns or just trying to figure out who to talk with in the district or what their rights are. A lot of them are not complaints or grievances. They're just trying to figure out some things. And so we always say we're kind of that person also. If parents give us that permission to talk with the district, we can kind of be that go-between to connect them back to a person. A lot of times people will call and they don't even know they have a special ed director in their school district, or they don't know, they don't feel comfortable making that phone call. They think it's just at the school building level, at the principal level, or IEP team level. And we encourage them to work through an IEP team. But I think that's important that parents understand. We're all very friendly people, and we're willing to help you, but it doesn't mean that you're always going to be filing a complaint or something formal. Sometimes it's a very informal. It's that other part of our job we do a lot of, is the technical assistance that we provide.
Do school boards play any role in those concerns? Is that maybe a step along the way if there are issues? Would that be a place to take some of those concerns?
So it really depends. Specifically, if it's staff related, it might be a great avenue for you to create some open dialogue around what your remedy would look like. School boards are able to work with the superintendents, who may then be able to work with their staff to communicate better. It also really depends on the issue. If it's IEP specific, typically the board doesn't get involved. And so they may refer you to the superintendent to remedy those issues. But if it's staff related, they definitely could get involved.
And how is, since filing a state complaint is a formal process, is there a specific place or way that you have to go about doing that?
Yes, so you can find it's called a sample complaint form on the Nebraska Department of Education Special Education Office website. And that is education.ne.gov/SPED. And on there is a checklist of different things that have to be contained. You can use the sample checklist or the sample form. The federal law requires that we not mandate what people put into the form, but it does require certain information be contained in the complaint. So it's very, very important that you just look at the checklist and either put it right there on the sample form, even though it says sample and watermark across it, or type it separately and then attach it to the document. The other thing is it does have to be signed. So this has created quite a barrier in this time where people don't have scanners at home and things like that. So we also are working to remedy some of those situations So should any parent have struggles with that, we encourage you to reach out to our office where we can create some electronic signature type situations for families.
And then if families have concerns or just want to contact the Department of Ed, the Office of Special Education, where would be like a good kind of like starting point? You know, there's several of you and your staff and your team. So where would, I mean, if you don't really know where to go and start that process?
So I would say start with me. You can always call our main line. We are currently manning all phone lines, even though our entire office is working remotely. So it goes to like a main hub right now where a message can be left. We also have staff assistants that at certain points during the day actually pick up the phone and will direct you to the person who is most equipped to answer specific questions. So if it is a question about a student who has autism, they may direct it to Teresa Coonts. If it is a question around transition, they may direct it to Teresa Hayes. Otherwise, just you can always email me and I try to get it to the appropriate specialized individual as well. Or we have a calling tree, and so it's just the next on the list. So we are all able, willing, and equipped to get you to the person who can answer questions.
Right. Jennifer, anything in the chat for concerns or grievances?
Nope.
Okay.
Nope, good.
Okay. Anything? Oh, go ahead. I'm sorry, Amy.
I would just add that if you're not sure if it's a concern or a grievance, also reach out to us. Just call us. We work extremely closely with PTI, and so you can always call them. They reach out to us as well to kind of determine where things should be at with either complaints. We also work really closely with our districts. I think on a daily basis, I'm talking to at least 20, sometimes 30 directors at different times. So a lot of things can just be as simple as a phone call to a district to say, hey, where's this at? Or do you know anything about this? And it creates some connections. So we are here to help at any point in time.
Any other questions that participants, families, providers that are on here have? I'm kind of opening it up. This is our other something if we've missed something and anyone has any of those additional questions.
I've got a couple here.
Okay.
Does the state follow up with the school district to be sure that they're implementing their continuity of learning plan, as well as providing services for students on IEPs?
Yes. So like I said, we're constantly having conversations. We also have rolled out multiple guidances along the way. And so we're reaching out and making sure that districts, A, have an understanding of the guidance, an understanding of the implementation of guidance. We have a statewide directors call that we're each month providing information to school districts. We also have multiple opportunity, not only through like concerns, but just districts who are reaching out to us saying, hey, what do you think about this as we move into phase 2 of our remote plan? So they're constantly wanting our feedback on those things as well. So we definitely, I would tell you, are in touch more actually right now than probably even before. Because before we kind of all thought we knew what we were doing. Now, you know, we've been really transparent and honest. None of us at the state have actually been through a pandemic either. So we're not really sure we're doing this right. So let's all just screw up together. But ultimately, we feel like there's way more good that is happening. And so in the few instances that there may be miscommunication or misdirection, we definitely try to work with everyone involved to make sure that that gets cleared up as much as possible.
Question here. Was it directed by the Nebraska Department of Education to move special education teachers to the general education classes?
Do you mean?
I'm guessing this person meant that the special education teachers, instead of teaching special education, were moved to teach general education classes?
Okay, so I might get on a soapbox, so I'll apologize. But like I mentioned before, special education students are general education students first. So the first avenue in which students should receive instruction should be general education. Now we know that some students may need specialized instruction, which may require additional support from either a specialized instructor or a provider of some sort. That would be a layer on top of the general education component. And then in addition to that, there may have been within an IEP resource pullout or different pieces. But ultimately, the initial or the construct of the IEP is to deliver instruction in the least restrictive environment, which should always be the general education platform. So we'll use the word platform in this environment first. So there was never an instruction to move teachers to a general education. So SPED teachers didn't automatically become general education teachers. What there was instruction to do is provide access. So if third graders in a district were going to receive an educational opportunity, that all third graders, regardless of if they have a IEP or not, receive access to that educational opportunity with the correct means of accessibility. So if they're visually impaired, that the right equipment is provided to that student so that they can access either the paper packet or the computer, so that they can hear if they have hearing impairment, or if they're a student with severe medical needs, those medical needs will be looked at so that the student can access an educational opportunity first. So I think it looks different for every single individualized student, but we would say the first place to start would be the general education access. And then unmute Teresa Coonts.
Knows I'll get on my soapbox, right? No, but really I want to talk about another TA document that we developed, a least restrictive environment document a few years ago that really covers birth to 21. And I think it's a great document. There's a chart in there that I think would help people to understand this a whole lot more. This is not new to the law. I've been around a long time. So general ed is where all kids should be. And then we start working on that process of the continuum, and we have to do that with each individual kid. It's not based upon a disability at all. So the least restrictive environment would be something to look at. But I know there's probably been a few challenges. I don't know if this is a situation where co-teaching was going on or something like that. And I would just say, you know, we haven't given directives like that, but we've just said, you know, kids need to be with their core curriculum, with their general ed environment, so they're having access. And then you work down you work with the continuum as you need to.
Okay. Next question. What guidance have districts been given on implementing an interim IFSP for infants and toddlers who need early intervention?
So Teresa Coonts, I see, wants to be unmuted, but so there really isn't a such thing as an interim IFSP. What there is a periodic IFSP, and districts, districts and providers are very familiar with what periodic IFSPs are. And so if they are doing interim IFSPs, then they're not doing it right. So the guidance has been that you continue in your same process, because this wouldn't look different, but if there is a need for that IFSP to look different, that you do a periodic and determine what those needs should look like during that time.
And really there's some good questions on that document that I think is in the slideshow that talks about some Part C questions that answers that question as well.
Yeah.
Okay. Are you able to highlight any innovations that districts are utilizing, such as use of paraprofessionals, specific technologies, etc.?
Sure, yes. So I honestly think you could ask across the state, there's all sorts of innovative things going on. I would say the most innovative is the ability to provide meals in such a capacity to students, including students with disabilities. But I think what we've seen that's been really, really cool is some of our really more severe disability groups, some of our significant disability groups doing things that we would have never thought possible. Like Teresa mentioned earlier, our deaf and hard of hearing groups having social events over Zoom, our you know, like our regional programs pulling different things together over virtual platforms. So I think there's tons of things happening. We've been invited to multiple graduations of students with disabilities in a remote environment, which I think has been extraordinary considering. So I was very grateful. I attended more graduations this year than I would have never, ever been able to attend because I could go virtually. So I just popped into like 20 of them one day. And that wouldn't have been something that we would have ever been able to do driving across Nebraska. So I think districts have been innovative in a multitude of ways.
Well, and I think they've used a wide range of technology too. And if it wasn't working right, they were searching to try to figure that out. I know we have indefiniteness because we were trying to figure out with Zoom, the darn closed captioning and just everything. And so we're kind of challenging, we're looking at new stuff all the time, and then we're challenging those companies on making it accessible. Just because they come up with something and it sounds pretty doesn't mean it's always accessible for the entire population of kids with disabilities. So I think being the voice there has been interesting. And I've heard some pretty cool things with paras, you know, becoming delivery people, you know, with technology and different things. So I think their roles have changed a little bit, you know, but they've also been delivering food and a lot of other things to just make sure. I think the thing we need to realize too is that our districts knew the families that might have some struggles, you know, with shortages of food or issues with Wi-Fi or any of those things. They kind of knew that already. I don't think this is new news for them. And I think they have stepped up to just say, okay, let's see what we can do. Can we purchase some of these things for parents? Can we, or for the students while they're working in these environments? Or can a paraprofessional drive to a certain area and be the Wi-Fi for this kid? I mean, those are the type of things that are happening. I think there's probably a lot more that's going on as well. I know virtually for professional development, I think we have nailed it because we've moved so many things virtually that, and our numbers are increasing more than they were before. And I think we're still learning in that environment, and we're going to be even better with the virtual PD that we're providing over time. People miss the social part. That's the part that's hard, because they want to see kids and say hello and all those things. So.
Okay, it looks like I've gotten a couple of questions as well. Do you feel the majority of students with a high level of needs and multiple disabilities are being served adequately in Nebraska during COVID-19?
So I think it's virtually impossible for us to answer that question since we're not members of IEP teams, we're not members of district delivery. I will tell you that we've seen districts do remarkable things. We've seen parents do remarkable things. I am a parent of a student with a disability who never wants to be a math teacher again, ever. Especially 8th grade math. So I feel like we've seen people step up to a plate that they never ever wanted to be at, right? And just knock it out of the park. So I think that we're lacking, or we're missing those success stories. And so sometimes our judgment is clouded by the continuously dealing with grievances or dealing with concerns. And so we don't get to hear the successes all of the time. So I think it would be misspoken for us to say whether or not these services have been delivered successfully. I think Teresa could definitely speak to their areas, because they have definitely seen success in those little areas.
And I did want to just circle back. I did have Heidi Summer from PTI Nebraska just sent me a message that that PTI offers information regarding dispute resolution and kind of how to work through that process and what that's like. So if you need some additional support with that, that would be a great resource to reach out to kind of work through that if it's, you know, if you've exhausted all of those other options.
I'm going to go back to your question on kids with more significant disabilities.
Sorry.
I know we can't answer that, but it's my passion. And I work with a population of kids with deaf blindness who rely on touch. It's their avenue for learning. It's what we know. And it's the one thing that keeps me awake at night. I'll be honest. I don't know. I mean, I hope that, the ones I've talked with, it's been kind of amazing, some of the things they're doing. The families I've talked with, they seem pretty okay with it, so, but to say that we're at 100% and meeting all their needs, I don't think any of us can say that. And it is the one that it worries me about the bringing back of those kids and what that will look like and what we do with the sense of touch, for the population of kids that need it. So, Hayes, do you have something, girly?
All right, there you go. Okay.
I'm going to be honest, I don't have anything, I know they're there and I cannot bring them up at the moment, but so I apologize for that. But
okay. So we are getting really close to the end of our session here, and I just wanted to take a minute to thank Amy and Teresa for coming and really clearing up a lot of the questions that we've been hearing from families and things that are kind of on the hearts and minds of those of us that are taking care of our kiddos and what school and education looks like going forward. So really appreciate you taking the time out of your evening to spend with us and we can pick your brains. And thank you all of our participants. I do have real quick, I'm going to go ahead and put up the poll since we are getting close here. If you would please, this really does help us. It allows us to kind of gauge if what we're doing is hitting the mark, if there's things that we need to tweak or change, so that we can be providing the best information and resources to families and make sure we're hitting on the topics that are meaningful. So if you wouldn't mind just taking a couple of minutes to fill out the poll, that will help us make for even better presentations in the future.